All right, welcome back to ABA Exam Review and the continuation of our BCBA Practice Exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass the exam, let us know so we can include you in the Sunday shoutout. Work hard, study hard. Let's get going. You're contacted by a client's parent to address a client who is itching their skin constantly. You ask when the itching began, and the parent tells you following a rash that appeared last week. Prior to intervention, what should be the first thing you do? Now, this is a very straightforward question because whenever you see some sort of medical condition or medical situation, such as a rash, a broken bone, sprained ankle, what we want to do is make sure it's been evaluated by a medical professional, meaning a doctor who is going to look at the rash or the condition. What we don't want to do is start behaviorally intervening on something that needs medical treatment first. So in this case, if we're looking at trying to start an intervention because our client's parents address this with us, what is the first thing we're going to do? It's not unusual for a parent, once you become their analyst, they start trusting you, they're going to present you with a lot of different situations. Almost anything that comes up in the client's life behaviorally, they're going to ask you about. So it's going to be your job to offer them guidance. If the client is itching their skin constantly and it's because of a rash, what do we need to do first before we start to intervene? A, ask if the parent has gotten a medical consultation. Yes, that's got to be first. Did they actually look at the rash? If they haven't got a medical consultation, is it a medical issue that we can wait out and see? Is the rash going to go away? Because if the rash is going to go away, there's really no point in trying to do this whole assessment and starting this intervention if the itching is simply caused by the rash. What about B, conduct an indirect assessment? An indirect assessment is not going to tell you a whole lot about the itching. If you ask the client, they might just say, I'm itching because my skin is itchy, right? Because they have a rash. Parents already told you when it started, which was the rash. So the indirect assessment is not going to give you a lot of information. Plus, we need the medical approval first. Conduct a full FBA. Following medical consultation or an agreement that you can start intervening on this rash, then you can conduct your full FBA. But first, we want to make sure it's not a medical issue. And then D, observe the itching yourself. Of course, you do want to see the itching, but the first things first, whenever it comes to anything health-wise, medical-wise, ask, have you gotten a medical consultation? Is there a need for medical consultation? If there is, go ahead and do it. If there's not, then you can go ahead and do your assessments and start your intervention. Ethan frequently argues with his teacher and refuses to participate in class activities when he is given direct instructions. A behavior analyst is brought in on a third-party contract to assess Ethan's behavior. After the assessment, the behavior analyst concludes that Ethan's behavior is an example of counter control. What suggestion would directly address the counter control behavior? Now, this idea of counter control comes up a lot, especially in Cooper. We don't talk a lot about counter control in practice, however. Now, you might have heard some people say, well, control is the fifth function. It's not really, right? Because measuring this idea of control is not very objective. However, this idea of counter control is real, and counter control occurs when a client or a learner is given direct instructions or they're presented with aversives, and in response, they try and take back some of that control. So in this case, Ethan is arguing with his teacher and not wanting to participate when given these instructions. So the behavior analyst comes in, sees Ethan's behavior, and says, well, this is counter control. I need to address it. So in our answer choice, be careful here. These are the questions that can get tricky. You want to address the issue at hand, which is the counter control behavior. We're not addressing escape or attention. We're addressing counter control. So let's make sure our answer choice addresses counter control. A, slowly increase the number of direct instructions provided to Ethan until the behavior reduces. Giving more direct instruction is likely only going to make the counter control worse. So A is not going to be very effective at addressing the problem. B, provide Ethan with choices intermittently when given a direct instruction. What would this accomplish? Well, this would accomplish giving Ethan choice, giving Ethan a say in his environment and his task, and this might help Ethan move past some of this counter control behavior. B looks pretty good. It's better than A. C, use a timeout from reinforcement procedure following Ethan's behavior. A punishment procedure, it might reduce the problem behavior in the situation, but is not addressing the issue at hand, which is the counter control. And then D, provide praise for Ethan when he completes his work, even if he argues or does not participate at first. In this case, Ethan is still engaging in counter control. You are reinforcing him for completing the work, but the counter control still exists. That's why it's very important we address what the question is saying. The question says we need to tackle counter control. That is our objective. And the way we're going to do that is by giving Ethan some choice, some control in his situation. And the best answer here is going to be B. Provide Ethan with choices intermittently when given a direct instruction. Notice how we read every single answer choice and we picked the best one. Always read every single answer choice, even if you're 100% confident in, let's say, A or B. You want to read each choice, understand why the wrong ones were wrong. A research team designs an ABCA treatment design. The team begins the first A condition and collects IOA data. The data in the first condition enter a steady state, so the team is prepared to move to B, but IOA is only around 30%. What should the team do? Let's think about this. We're looking at the team's next move here. We know we have an ABCA treatment design, so it looks like some sort of baseline, intervention 1, intervention 2, back to baseline. They start baseline, they start the A condition, and are collecting inter-observer agreement. Now, in baseline, the data go into a steady state, which is what we're trying to accomplish. So typically, once your behavior or your data in the baseline enter steady states, we can move to intervention. However, in this case, IOA is only around 30%. And what does that mean? Well, that means who's ever collecting IOA data, let's say it's 2 people, they're not really agreeing on what's happening. 30% is very low for IOA. Now, there's no hard and fast rule, but a good standard is about 80% for IOA. 30% is extremely low, meaning one researcher or observer has one data point when the other researcher is not agreeing with them very often. So what should the team do? We have data in a steady state, but they're not in agreement. A, enter B since they're a steady state responding. If we weren't taking IOA, then we could, but we have to address the issue of the low inter-observer agreement. B, enter B and continue monitoring IOA closely. Well, we're already monitoring IOA, and what it's telling us is the research team does not agree on what is occurring in the intervention. That's a problem. So C, not enter B and investigate the IOA data. We're not in a rush when we're intervening, especially in research. You have to address problems as they come up and not just push through and hope they go away. Even though we're in a steady state, we cannot just go to condition B without figuring out, well, what's the disagreement? Where is that coming from? So we don't enter B. We have to investigate that IOA data, figure out where the conflict is, and then we can go from there. A behavior analyst observes a group home for 3 days during lunch. The analyst tells the manager of the home that it appears the members of the home are much less compliant on days they do not get dessert. What is the best way to describe this observation? So this is an interesting question because we're describing an observation. And what do we mean by that? When we observe things, we can describe them in different ways. We can do what's called a descriptive observation, where you just describe what's happening. That might look like the analyst saying the members of the home aren't compliant. They're not giving a reason. There's no hypothesis. That's what's happening. The members of the home are not compliant. You can be correlational, where you make an observation, there's no compliance, and then say, well, it's possibly due to them not getting dessert because you've observed some sort of relationship. And then you can do a causational observation, where then you're actually taking data and letting the data show if one thing is causing the other. It's almost impossible to get pure 100% causation, but the more experimental control we can see and the more data we have, we can get close to causation. So what do we do here? Did we do a descriptive observation? Well, the analyst said they're less compliant, but then gave a potential reason why they did not get dessert. So the analyst is making a correlation between the lack of compliance and the lack of dessert. They did not say, I've taken data, the cause of the noncompliance is the lack of dessert. They simply said, I see they're not compliant. I also see they're not getting dessert when they're not compliant. That's a possibility. And what about D, an observation of functional control? Well, we can't have an observation of functional control without data and without manipulation. And we haven't manipulated anything. We haven't done any experimental design. The analyst is simply observing some sort of correlation. They're less compliant. I've noticed on days they do not get dessert. That is when the noncompliance happens. That is one possibility. From here, now the analyst can do experiments and try to figure out, is that the cause or is there another cause? And then finally, a type 2 error is also known as a what? Now, this is a very, obviously a straightforward question. It's just a definition question. Why is it here? It's a learning question, right? We want to know what a type 1 error and a type 2 error is. And in real life, people really call them false positives and false negatives. But in Cooper and in a lot of our prep, you're going to see type 1 and type 2 errors. So you have to know it. So this is simply an education question. A type 1 error would be a false positive. What is a false positive? It says your intervention affected the behavior when it actually didn't. So the type 2 error is going to be the opposite. It's going to be a false negative. It's going to say your intervention did not affect the behavior when it actually did. And so a false negative is the opposite. You make an observation on your intervention and you say, well, it didn't work, when in actuality, it did work and your observation was incorrect. So type 2 error is going to be a false negative. It's not a visual error, not a data error. Could it be? Maybe. It might be a visual analysis issue. It might be a data analysis issue. But we're not going to call a type 2 error a visual or data error. We're going to call a type 2 error a false negative. All right. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Be sure to subscribe for all of our updates. We post weekly. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.